मैं हूं फैजान, दिस इज रेडियो 4 नंबर 1 फॉर हिट गाने एंड टुडे वी हैव डॉक्टर समय मुनीर नसीम in our studios, who's a specialist cardiologist at NMC Specialty Hospital, Sharjah.
Thank you so much.
Well, people in this part of the world especially suffer because of heart problems and hypertension being one of the most common of them. So what is hypertension, sir?
It is the highest level of blood pressure, whether it is systolic or diastolic. The systolic more than 140 and the diastolic it is more than 90.
Okay, so what are the different type of hypertensions that you're talking about?
We have two types of hypertension. It is primary hypertension and second one is called secondary hypertension.
And what about the grades of hypertension?
Yes, there is grades. There is first one, it is high normal, and we're starting with grade 1 hypertension, grade 2 and grade 3 hypertension.
So how do you diagnose that a particular person is suffering from hypertension?
The diagnosis of hypertension in the office, it is based on at least 2 blood pressure measurement in the sitting position on at least 2 visits. The systolic blood pressure should be more than or equal 140 millimeter mercury, and the diastolic should be more than or equal 90 millimeter mercury. Apart of this blood pressure measurement, the medical history and physical examination, laboratory investigation should be performed in all hypertensive patients to determine their future risk of cardiovascular disease, like some lab tests of hemoglobin, cholesterol, triglyceride, glucose, sodium, potassium, uric acid, creatinine, and finally the electrocardiography.
Tell me this, Dr. Sameh, why is prevention and treatment of hypertension of utmost importance?
Because hypertension is a major risk factor of cardiovascular disease over the worldwide and is mainly achieved by healthy lifestyle modification and early identification of hypertension and the management of both by lifestyle and the hypertensive drug treatment.
You talked about lifestyle modifications. So what lifestyle modifications are required for a person who is actually suffering from the disease?
It should reduce the salt and healthy diet and weight reduction and regular exercise and smoking cessation.
Target blood pressure. So what is the target blood pressure during the treatment of a patient suffering from hypertension?
The target blood pressure, it should be less than 140 for the systolic and for the diastolic at 90 millimeter mercury, and for the diabetic patient it should be less than 140 for the systolic and 85 for the diastolic in the diabetes.
Thank you so much, Dr. Sameh Munir Naseem, specialist cardiologist, NMC Specialty Hospital, Sharjah. Thank you so much for coming to the studios and giving us this interview.
Thank you, sir.